Today we are talking about longevity medicine as well as functional medicine. There are some nuances that make them a little bit different, and we're going to specifically talk about therapies like NAD, glutathione, metabolic injections, maybe some hormones in here. There's a lot of people that hear all these buzzwords but don't really understand what they're for, who they're for. Maybe they should receive them, maybe they shouldn't. So I'm here with Dr. Boyd at Epiphany. And this is a place that focuses on integrative health and longevity medicine with hormone balance, metabolism, immune support, and ultimately healthy aging. Let's start with a big question that will help our listeners just have a framework to understand where we're coming from. What is functional or integrative medicine? What's longevity medicine? What are your approaches and kind of how you view those two big words?
Traditional medicine. If I have a sore knee, traditional medicine would say take an Advil or a Celebrex or some Tylenol. So that's the disease-oriented format. What integrative or functional medicine would say is, why do you have a sore knee? Understanding the why then allows us to hopefully prevent that in the future. So longevity medicine, let's use that terminology. Again, we can use integrative, we can use functional, but in this context, we're going to use the terminology of longevity. Longevity medicine is kind of a functional approach to looking at medicine with the understanding that we want to slow down the aging process. So the three pillars I would like to specifically address are lifestyle, diet, and activity. Lifestyle would be going to bed every night at the same time and waking up at the same time every day, trying to reduce stress in our life. Diet would be eating organic food and doing reverse osmosis system for your kitchen sink. And then obviously activity, making sure you're getting out of the chair, trying to identify how many steps you take in a given day.
You mentioned going to bed at the same time. What are some other things that are very important if we would go back to the human state of healing ourselves with nature? What are some other things that we're not doing that are super important for everybody to be doing every day to optimize our health?
So specifically addressing lifestyle, cortisol is the buzz. You TikTok and social media, everybody's talking about cortisol. Everybody understands that cortisol is elevated, but they don't know exactly what that means. And on the other end of the token, how do we reduce cortisol? Cortisol is a hormone that really has one purpose: fight or flight. A bad man's coming at you, and you've got to make a decision that I'm either going to run or I'm going to fight him. As soon as that event is over, you've either ran or you beat the man up, then your cortisol level should return to normal. And that is the baseline that we should be at on a day-to-day basis. But because of the crazy world that we live in, stress all the time with our jobs, our families, all of those affect your cortisol in a very negative way. And so we always are on an elevated cortisol spectrum. And the interesting thing about cortisol is if it stays elevated, it causes your body to be stressed seriously, because you're always on this on guard type of situation, and you imagine you're tense all the time. But at a cellular level, it's even more damaging, because what it does is cortisol increases insulin. Insulin is the hormone from your pancreas that allows you to gain weight. Obesity then causes disruption of your sexual hormones, your testosterone and your estrogen. When those become disrupted, they affect your cortisol in a negative way. So you get into this vicious cycle of elevated cortisol, elevated insulin, decreasing testosterone and estrogen. That causes inflammation in the body. When you have inflammation in the body, you have breakdown of your tissues. You have aging that happens faster than you need to be. So in our functional medicine, integrative medicine, longevity medicine, we try to break that cycle. Therefore, we reduce inflammation. Therefore, we make the body healthier.
So, for example, cortisol naturally should increase during our waking hours to help us wake up. But one thing that people always wonder is, okay, once I'm awake, what are some things to help reduce that cortisol? Because I'm awake, I'm ready to go, but now I need it to slowly decrease. So what's something that someone getting up in the morning can do immediately to help start to reduce that cortisol level?
Number one, you drink a 15 to 16 ounce glass of water immediately. If you have the ability to go outside, live in an environment where you can go out and get red light therapy, UV light from the sun, you go out and sit in that UV light situation. Now, if you don't have that, we recommend red light therapy, red light panels, and you would sit in your underneath your red light for 7 to 10 minutes. We obviously recommend some type of meditation or thinking about your day in a calming fashion. I recommend prayer, but anything like prayer or meditation would be very beneficial. All three of those things.
One therapy that is getting a lot of attention in longevity medicine is NAD. What is NAD?
So NAD is a very complex coenzyme. NAD stands for nicotinamide adenine dinucleotide. Now, nobody's going to remember that. So NAD is an acronym for those three words. So in a nutshell, what NAD does is it works on the mitochondria of the cell. The mitochondria is the part of the cell that produces energy for the body. You eat food, and that food gets converted by NAD in the cell to produce energy. And so as we age, NAD decreases. And so when you get to be my age, you have about 30% of the NAD that you had, or that I had when I was in utero in my mother's womb.
Something that I don't think everyone knows is, again, going back to the nutritional side of things, that NAD actually is broken down from B3. It's a precursor. Right. So going back to the nutrition side of things, why can't people just increase their B vitamins and have NAD? Why is it so important that NAD is one of these buzzwords that everybody's taking this supplement form?
So NAD is necessary for the cell function, as I mentioned. It works on the mitochondria and it cleans up the DNA. So imagine removing NAD from 60% of my cells, 60 to 70% of my cells. Then those cells now are void or markedly deficient of NAD prior to when I was younger in my age. So who's going to manage the cell at that point? The mitochondria doesn't have NAD to convert to energy. And if you don't have the NAD, you can't repair the DNA that is there. Now, in answer to your question, the B complex vitamins, there's B1 through B12, there's only 8 B vitamins. B3, vitamin B3, is called niacin. Niacin is usually obtained through our diet, through our food. It should be obtained through our food. Now, the problem with today's world and today's food, and Bobby Kennedy says that 70% of our food is bad for us. I would argue it may be even more than that. But if we have the inability to obtain B3 in our diet, everything suffers after that. And so as we age, not only are we deficient in our NAD from our consumption of our food, the inflammation that occurs because of our bad food prevents the B3 from working in our body, from being converted into NAD.
Anyone listening that's ever been in a biology class and we learn about the Krebs cycle and we learn about how energy is produced, it's going to be one of the cogs in how the mitochondria actually produces ATP. Right. But we never actually thought of it as a supplement, or, okay, if we remove this little cog, what domino effect will it have on cellular energy? And now we're seeing it with so many people getting sicker and sicker, and they're younger and younger, and they don't have this energy. More on just a layman's terms, if somebody says, I think that sounds good for me, I might want NAD, what would they actually notice that would make them feel like on a daily basis they're getting benefits from NAD?
From a supplemental standpoint, at the biological level, you're going to feel better because you're going to have more energy, because NAD improves output of energy. Again, it improves mitochondrial function. When you improve mitochondrial function, the food that we eat is going to produce more energy for the cell. So we're going to have more energy. Our muscles, we're going to have less muscle wastage or slower muscle wastage over time. So you're going to have increased energy because your muscles work better. The liver's going to work better. Brain fog may improve with NAD.
Move on to another therapy that everyone's talking about, and that's glutathione. What is glutathione?
So glutathione is a tripeptide. That means there's 3 amino acids that make up this peptide. The beauty of glutathione is it is a powerful antioxidant. And so people don't realize that the peptide world is really about reducing inflammation. Because if we reduce inflammation, we reduce aging. And not only do we reduce aging, we make people feel better. So one of the words that we use in our office frequently is age healthier, live happier. It's not that we're going to prevent death, but as we age, if we are healthy, typically we're going to be happier.
Why would someone need a powerful antioxidant?
Well, the inflammation that occurs in all of our bodies over time is due to the fact that we have bad food, we have bad water, we have toxins that are sprayed on all of our crops, we have toxins that are falling from the skies. All of those land on our bodies and in our bodies. And when they land in our bodies, they create inflammation. Think about a splinter. You get a splinter in your finger, and everybody's had one. It's a little tiny thing, but it causes quite a bit of discomfort. Well, think about millions and millions and millions of splinters inside your body. They land in the cells, and the cells are inflamed because of those toxins. That over time causes aging to occur faster, causes chronic illness to increase. When I say chronic illness, I'm talking about cancer, I'm talking about diabetes, I'm talking about high blood pressure, I'm talking about all the autoimmune diseases, lupus and Hashimoto's. All of these increase because of inflammation. As the body becomes inflamed for all of the things that we've mentioned, one of the byproducts, the junk, is what we call oxidative radicals or free radicals. And then free radicals run around the body and cause problems with other cells in the body. And so that's called oxidative stress. And so if you reduce, so again, everything is happening. If we reverse everything by reducing oxidative stress, then we're going to slow the aging process and we're going to keep people healthier.
So is glutathione something that would be good for someone to take preventatively?
Again, we're on a low level of inflammation all the time. And variations occur even in the healthiest person that does everything that they're supposed to do. We live in a world that's bombarding us with toxins. So glutathione supplementation is something we highly recommend.
Another therapy that is very unique and not a lot of people know about it is sermorelin. How does sermorelin work differently from growth hormone?
So sermorelin's a very interesting peptide. And so what sermorelin does is it helps stimulate your own pituitary gland, which is a gland that's in your brain, to produce what's called human growth hormone, HGH. When you were in utero, you needed human growth hormone to grow. And so this HGH, human growth hormone, was an FDA-approved drug until about 15 years ago. And it was given to young people that we were concerned about their growth, they're achieving what they should do. Now, sermorelin is used in what we call off-label treatment. We like sermorelin versus giving synthetic HGH to patients because sermorelin stimulates your own HGH. And from a standpoint of body heal thyself, at Epiphany, we think that makes more sense. So again, HGH slows the aging process down. It will make people feel younger.
With what you've discussed, it was important in utero to help us grow, and as young children, we need growth hormone to help us grow. If children don't have enough growth hormone, they were given this to help them reach a normal height. But why would we give this to an adult?
So first of all, human growth hormone as an adult does not cause you to grow more. It improves energy. It allows your insulin in your body to work better. And so if insulin doesn't work very well, there's this term that many people have heard called insulin resistance. Well, insulin resistance goes down with with HGH. And those are several of the things that are benefited with supplementation with sermorelin.
Is there lab testing to maybe check on like insulin growth factors or thyroid function, maybe tumor markers, anything like that that needs to be monitored when people are on this?
Monitoring for HGH is done by blood testing, okay? And we use a specific blood test called an insulin growth factor 1. Insulin growth factor is a blood test that identifies if your HGH is low. And most people that we monitor will have low insulin growth factors, and that is a determining factor for should this patient receive Sermorelin or not. So again, it's a safety issue versus just ordering Sermorelin online or going to a clinic where they don't evaluate you is in my opinion, poor medicine. Because your thyroid is one of the most important hormones in your body, there is a important understanding that HGH and thyroid can cause problems with each other if you have one that's too much or one that's too little. And so one of the things that is very important with the Epiphany practice is we strongly encourage patients to have hormone optimization. And that means monitoring the thyroid, specifically if we're going to consider Sermorelin.
So weight management peptides like GLP-1s, which are actually GLP-1 receptor agonists like Wegovy, Zepbound, Ozempic, Mounjaro, which are actually just these FDA approved GLP-1s, are very common. And most people hear about them being approved for type 2 diabetes or rapid weight loss. How do you approach these GLP-1s?
The GLP-1s, glucagon-like peptide, was created for type 2 diabetes. As you take a GLP-1, it reduces your blood sugars. That's what it was created for. Now, what they also identified was significant weight loss that occurs with the GLP-1s. The problem with the drugs, and they are FDA approved, is that people have had massive weight losses. I mean, sometimes several hundred pounds. My frustration with the GLP-1s, the way they're given to patients today, is with little to no education. Right now, there's many doctors around this country that if you simply send them a form about your health history, they will send you a prescription and you can start on your own GLP-1s. No oversight at all. And they will send that to you as long as you want. So there's no end game.
What's the problem with losing hundreds of pounds or even 40 pounds in a very short period of time, like a few months?
Well, the main thing is malnutrition. Now, this is unbelievable to think about. If you have a 300-pound person and they lose 50 pounds, and I'm calling them malnourished, and you say, you're still 250 pounds, how can you be malnourished? All of the cells, and again, let's go back to the cellular, the 30 trillion cells. All of those need energy to work efficiently. So if I am not giving myself food, all of those cells are going to become compromised. They're either going to quit working or they're going to die. So we're losing weight. The cells at the micro level are not working well or not working at all. So we become malnourished.
I think something that people maybe don't understand is malnourished isn't just a calorie deficit. It's also a vitamin and mineral deficit.
Absolutely. It's all the things that you need in your body that food should give us. All of those things are necessary for the cell to work. Coenzymes and cofactors. We are seeing something called scurvy that we haven't seen in 200 years, back when we had pirate ships. Scurvy is now increasing because of the severe malnutrition that is occurring with the GLP-1s. It's the lack of fruit specifically. So all of us, to some degree, get vitamin C. Usually it's through orange juice. But anybody with a low vitamin C level, severe, is called scurvy. If we have really low vitamin C, we have severe immune compromise and patients get sick. So we're truly trading one problem for another. When I talk about people's end game, how long am I going to stay on this? What is my goal weight? What do I want to look like? And providers across the country are doing a really poor job in discussing a plan for those patients. All patients should have a specific plan when they go on GLP-1s. That's what we do at Epiphany. We have to understand where we're going. You have to have the replacement of minerals and vitamins that are necessary. We offer a product that we give when we give GLP-1s that addresses the malnutrition that can occur from the lack of minerals and vitamins. So where are we going? What is our food going to look like? What is our activity going to look like during this process of GLP-1s? We strongly disagree with giving GLP-1s without having a plan.
So it's not that you're against this peptide, it's that you want to have someone under very good guidance from a licensed provider. You want them to have realistic expectations of how much weight do they actually want to lose. You're probably going to manage somebody that wants to lose anywhere from 15 to maybe 50 pounds, and making sure that they have expectations and where they're going and the correct nutrition to go along with it. What GLP-1 do you provide at Epiphany?
So we use a GLP-1 called liraglutide. It's L-I-R-A glutide. And that differs from semaglutide and tirzepatide. The main problem with GLP-1s that people don't realize is they cause nausea, vomiting, diarrhea, or constipation in a great many patients. And it's dose related. So the higher the dose, the more the symptoms are there and can be quite dramatic. They also cause significant inability to eat. People have no appetite at all. And again, if we don't replace the things that we're losing and keep our cells healthy, we are changing one problem for the other. So why did I choose liraglutide? As I investigated the semaglutide and tirzepatide, they are given on a weekly basis. So you give an injection every week. Now, if I understand that the side effects are nausea, vomiting, decreased appetite, diarrhea, constipation, I give an injection on Monday. That drug is in the person's body for a week, and they have all of these symptoms. And they're not going away until it wears out of your system. Liraglutide is given daily. So that means if it's given on Monday, it's out of your system by Tuesday. Now, why is that important? Well, there's two parts to the equation of taking care of patients. If you're going to give a supplement or a drug, you want them to feel good and you want to minimize side effects. And so if the side effect panel is very, very high, then the drug or supplement doesn't make any sense. So tirzepatide and semaglutide, I don't like the fact that they're in the body for a week. That's number one. Number two, the weight loss with those two products, semaglutide and tirzepatide, is dramatic. Slower weight loss is much healthier for the patient. Malnourishment is at the cellular level. If we lose weight slower, we're less likely to be malnourished. So when we talk about liraglutide, we basically have 5 levels of dosing. And basically over a 35-day period of time, and that's our therapy, it's a 35-day cycle of subcutaneous nightly injections. And you increase up to a point where their symptoms may be a problem. And then at that point, you stop. Symptoms meaning nausea, vomiting, diarrhea, constipation, no appetite. We don't want those symptoms. So we, at Epiphany, typically try to just use an increasing dose to maybe the 3rd level, and then try to keep them on that level as an anti-inflammatory and a weight loss combo. So 2 35-day treatment cycles. The expectation for weight loss would be anywhere from 15 to 30 pounds. So nothing dramatic like the semaglutides or the tirzepatides. Now the problem is if you are talking to your friend and they've taken semaglutide and they've lost 50, 60, 70 pounds in 3 months, the context for you is that's what liraglutide should do. But we don't want to do that.
Yeah, I think that's something that people are starting to notice after they've been on tirzepatide or semaglutide for a while, is that rapid weight loss, but they did have to keep increasing their dose to actually continue losing weight. And then on top of that, it was more just like this door with a stuffed closet, and as soon as they let go, all the weight comes back. So I know for you at Epiphany, you mentioned the lifestyle and the nutrition and activity. So when you're managing your patients and it's this slower weight loss, are you having that patient also be a part of the journey and working hard to change their activity, change what they're eating, change their lifestyle, so that when you stop the cycle, they continue losing weight or continue maintaining their weight loss?
So I think you have asked a fantastic question that is the difference between traditional medicine and longevity or functional medicine. Traditional medicine, again, is a disease-oriented state where you have a disease and then the doctor tells you what to do. If you look at longevity or functional medicine, it is patient-centric for them to be part of this journey. I'll give you an example. So you come in to see me and you are 220 pounds. And your goal is to be in the 100 range. And we think that's a very good journey. So I'm going to take you at 220, and our goal is to get you somewhere around 190. So you have a 30-pound weight loss. So we would say to you, okay, understanding that you're here, we want to be here, so we have an end goal. And how do we do that? So we would offer liraglutide, and we would say, okay, you're going to be on this dosing, you're going to do subcutaneous injections, and we would do 2 rounds of 35 days, okay? So that gives you adequate time from a drug standpoint. Now, lifestyle. We would want you to, again, get a good night's sleep. We would want you to try to reduce stress because, again, stress increases cortisol, which increases insulin, which causes you to gain weight. So reversing that is very important. So reducing stress in your life with a lifestyle. Diet. We would want you to go on an organic format. We strongly believe in high protein. People get tied up on this calories, this caloric intake, and they spend a lot of time worried about the calories. We believe at Epiphany that if you just simply count protein, and as a woman, you want around 100 grams of protein per day. A man, you want somewhere between 120 and 150 grams of protein per day. In addition to the high protein diet, we want you on a high fiber diet. Now that doesn't mean Metamucil. That means blueberries and chia seeds and kiwi and apples. If you do just those 4 things a day, you get to 35 grams of fiber. Think about the way a teeter-totter works. As the fiber goes up, insulin comes down. As your insulin comes down, you lose weight. As your protein goes up, your insulin comes down and your weight goes down. And then the third part is just watching where you're at from an activity standpoint. I've got an iWatch on here. It has a step counter. My daily goal is a minimum of 5,000 steps. So liraglutide, nightly injections, lifestyle. Go to bed every night at the same time, try to minimize your stress, get UV radiation from the sun or from a red light therapy. Diet, you eat organic whole foods, you try to have a high protein diet, try to have a high fiber diet, and then activity, you try to have 5,000 steps per day. I want to mention maintenance of GLP-1. The GLP-1, semaglutide, and tirzepatide are maintained for patients, but with no goal, no end game at all, okay? Just that you're going to take this dose until the cows come home. They go to their family doctor, their internist, they say, I want to lose weight. He writes the script. Literally, he can be in the room 30 seconds and walk out. A lot of times they don't even follow weights or blood pressures or anything like that. Now, as far as maintenance therapy, if we're talking about using the GLP-1s for reducing inflammation, that can be every day of their life. And so back to my liraglutide. If we give the lowest dose or the second lowest dose and give that subcutaneously every day of your life, it is a great anti-inflammatory.
So back to the nutrition side of things, liraglutide is helping them lose weight slower, and they're having fewer side effects, and the risk of them not having an appetite is not as severe as with tirzepatide and semaglutide. Is there specific vitamins or supplements that you tell your patients you need to be on these, especially while you're on GLP-1s?
The answer to your question is yes. When you're on the GLP-1s, you run the risk for having the inability to absorb minerals and vitamins. And minerals and vitamins I'm talking about excluding the caloric part of food, the energy part of food. I'm talking about the vitamins and the minerals that we need to obtain through our food. Many times they're not in our food. And if our calories are markedly reduced, we're going to have markedly diminished vitamins and minerals enter our body. So you have to understand that this is a real problem. And again, it's education for you as the patient. Methylated vitamins are something that are not discussed with patients on any regular basis. Methylated vitamins mean that the 5-MTHFR system, it simply means that I have the ability to take a vitamin or a mineral and allow it to be absorbed. So up to 40 to 45% of all people have the MTHFR defect or gene missing. So that would mean almost half of the country, half of the world does not methylate their vitamins or minerals in a fashion that allows the absorption to occur in the body. So you have to have a methylated vitamin. And so we have one here at our company, BioT, that has methylated vitamins. Gary Brecka, who I think strongly of, has a product called 10X, Methylated Multivitamin Optimize. Almost everybody's heard of B12, vitamin B12. You get vitamin B12 by eating animal parts. That's the best way to get it. So cow liver, cow tongue, cow hearts. Nobody does that to speak of. So we give vitamin B12. First of all, you have to check it. And so in our practice, everybody is low in where we want them to be from a vitamin B12 level. So if you look at most people that we do blood work on, they have a B12 level of somewhere between 2 and 500, most people. Well, we believe in optimizing B12. And so when we treat people, we want their B12 levels to be around 1,200, between 1,000 and 1,200. How do we get there? Well, you can tell them to go home and start eating liver, but they're not going to do that. So we replace vitamin B12 with injections. And depending on what their value is, we give vitamin B12 weekly, sometimes for several weeks. And then we tell the patient, we want you on vitamin B12 for the rest of your life.
So what about with the reverse osmosis and minerals? So we address the vitamins, but minerals are incredibly important, like magnesium. How should these patients make sure that they're getting good minerals?
So that's a fantastic question. So reverse osmosis system not only removes all the bad junk, it removes all the good stuff as well. And so truly you have a water that is deficient in the things that we need. And so you have to replace those. The one that I recommend is created from the Great Barrier Reef in Australia. And you put between 10 and 20 drops. It's a trace mineral.
Okay, so we've covered a lot of different peptides and supplements. One thing that people hear on different podcasts is, especially with peptides, that there's black market peptides, there's gray market peptides, and then there's the good, safe peptides. And most people in the medical world would say, well, those are only the FDA approved ones. How at Epiphany do you not get the FDA approved peptide, but you're not in the gray or black market to make sure that your patients are receiving actual peptides that are safe for their bodies?
So compounding pharmacies are used in the functional longevity medicine frequently by providers all over the country. The products that we use, though, we want from a pharmacy that is reputable, that has FDA guidance, and those are the products that we use. There are clinics around the country that do not follow that format. They would order a GLP-1 from a pharmacist that is really gray. There's no oversight. In fact, the vials will say not for human consumption, for research only. Those are things as a patient you don't know unless you ask your provider, and I would encourage you to do that. We use a sterile technique compounding pharmacy out of Orlando, Florida. They follow FDA guidance. In fact, the FDA was just there a couple weeks ago. I would encourage patients to ask their provider, where are you getting your peptides from?
Your clinic, Epiphany, does a lot of hormone therapy for men and women. How do all of these peptides and supplements work together with hormone therapy for men and women?
So I mentioned earlier that longevity medicine is really what we're about. And longevity medicine is not anti-aging. I much prefer the process of slowing aging down. The main pillar of Epiphany is hormone optimization. Now, you have to understand what hormone is, and then in understanding what hormones do, then optimization makes sense. A hormone is simply a messenger vehicle. So it is a spaceship that's flying through your body. You have over 50 hormones in your body. We've mentioned them: cortisol, insulin, testosterone, estrogen, thyroid. Those are just some of the hormones in your body. The interesting thing is they serve no purpose until they bind to a receptor. So spaceship's flying around, it has to land at the space station. It has to land at the space station exactly right. So hormone optimization is several factors. First of all, we have to make sure you have adequate hormones. You can't optimize hormones if you don't have adequate amounts. So we measure those. We're going to recommend that your testosterone should be around 150 and your free testosterone should be around 10. So getting you to that level is optimizing your hormone. Then your hormone can float around the body that we give you, but it has to still bind to the receptor. So even if I give you hormones and your receptors are all full, I have not benefited you. So what do we do with those receptors? Well, we try to encourage lifestyle changes and diet changes that allow that receptor to have the junk that's stuck on it, a toxin or a piece of plastic, to be reduced so that the testosterone can land on that receptor and do what it's supposed to do. So that is one example of hormone optimization. You have to understand the body is incredibly complex. Everything is dependent on something else to do what it's supposed to.
If someone is listening to this and resonates and wants better energy, metabolism, wants to age healthier and live happier, what should their first step be?
So we'd love to see you at Epiphany. Come see us, book an appointment online, go to epiphanywomen'shealth.com, epiphanywomen'shealth.com. You can be a woman or you can be a man. We will see both of you. When you come in, we will meet you. We will talk about much of what we have talked about today. We will draw your blood, do what's called a well woman panel or a well man's panel. And then after that is drawn, we see you back, go over your labs, and develop a plan.
Okay, thank you so much for sharing all of this information. So like Dr. Boyd said, go to epiphanywomen'shealth.com. You can book online and they will draw your labs, discuss a plan with you, and help you age healthier and live happier, in the words of Gary Donovitz.